Medical costs have long been a mystery. A report from a nonprofit is trying to add clarity in the hopes patients know how much you'll need to pay when you need health care. The hospital price transparency rule started in 2021. The law first established that hospitals must post standard charges for all items and services and prices for the 300 most common services. So that's something like a price estimator tool. This past summer, the rules were updated to add more format consistency and more information.
Even for hospitals that are compliant fully by everybody's standard, it's still hard to shop around for medical care.
That's Chris Garman. He studies healthcare pricing at UMKC. He says the most important piece is that price estimator tool.
That makes it a whole lot easier for you to search for the surgery you need and how much it's going to cost you.
PatientRightsAdvocate.org is a nonprofit. The group assesses the transparency of hospitals by looking at their online pricing. I went through the group's most recent report. They looked at 19 hospitals in the Kansas City area. Here's the issue. The nonprofit and the hospitals don't view the federal guidelines the same. The nonprofit adds an extra level of scrutiny on the federal guidelines.
I would say we go further than a first level look, and we look at the entire file to see if every single insurance plan that the hospital accepts is posted and if the majority of prices are in the data fields.
For their part, those hospitals argue that they are in compliance with federal law. Now back to Chris Garman, that UMKC expert. He recommends patients look for those price estimator tools.
I would encourage the consumers to go and use these price estimator tools. Go on to the hospital's website and put their information in if it's a hospital they're considering for their procedure.
I focus my coverage on healthcare costs. If you have a story tip, you can scan this QR code on the screen and send me an email with that idea. Elise Schoenig, KSHB 41 News.